Welcome to Beyond Diagnosis, how physicians counsel patients on living well across specialties. In this podcast, we learn from the experts how all specialties practice preventive medicine. This is geared towards medical students who spend countless curricular hours learning the disease model and how to treat sick patients. This is a supplement to help us improve the lives of our patients by promoting optimal health and well-being, addressing the root causes of many conditions. My name is Michelle Omega, fourth-year medical student, hoping to one day be a family med doc, and today I have the honor of being with our expert in neurology, Dr. Vu. Welcome, and thank you so much for being here, Dr. Vu.
Thank you.
Disclosure, this is for educational purposes only. Please see your doctor if you have any concerns about your health. Second, Dr. Vu, I just wanted to confirm verbal consent to publish this episode.
Yes.
Sounds great. Thank you. Let's get right into our introduction. Dr. Anh-Thu Vu is Clinical Assistant Professor in the Department of Neurology at Thomas Jefferson University Hospital, as well as Assistant Professor at Drexel University College of Medicine in Philadelphia. She received her master's degree in neuroscience at Tulane University, went to medical school at Joan and Sanford I. Weill Medical College at Cornell University, and completed her neurology residency training at the University of Pennsylvania Health System. She subsequently did fellowship training in movement disorders at Emory University. Dr. Vu is a committed educator, serving as the Director of the Neurology Clerkship and Neurology Pathway for Drexel. In addition to teaching and education for medical students, she has interests in improving health equity within neurology and career development in medical education. To start off, could you tell us broadly what conditions you treat?
I'm a movement disorder specialist, and I treat people who have all types of movement disorders. That includes many zebras, different unusual genetic conditions that cause ataxias and dystonias. But truly, my bread and butter are the conditions such as essential tremor, and the vast majority of the patients I see have Parkinson's disease. Now, we typically think about Parkinson's disease as a neurologic disease that affects how people move, but really it is truly a multi-system disease. So it impacts people's blood pressure, it can cause constipation, mood disorders, among a multitude of other symptoms. So sometimes I like to conceptualize myself as a primary care doctor for people with Parkinson's because I treat so much about their condition. I am usually the first pass for many things before I send them off to a specialist. So I will help to treat their constipation, their orthostatic hypotension, depression, cognitive issues, urinary issues, among other things, before I send them off to a specialist.
What does a typical week look like for you?
I spend much of my time doing education, actually. Run the neurology clerkship, so a lot of my time is devoted to direct student teaching and coordination of the clerkship, as well as career advising for students interested in pursuing a career in neurology. I do have 2 days a week in clinic, so usually I have a full clinic day. I start my clinic day at 8 o'clock with about an hour of a break for lunch. My patients are scheduled to end by 5 o'clock, but I'm usually spending an extra hour or so with a little charting and catching up because I want to give my patients as much time as I can give them. Sometimes I have trainees along with me, whether they're residents or medical students, and I spend most of my time just talking and examining patients. I'm quite old-fashioned that way. A lot of my time is just devoted to really taking a very thorough history, doing a thorough top-to-bottom neurological exam, and providing a lot of counseling and a lot of empowerment for patients to do things to make their lives better.
In the office, what are the healthy habits and behaviors that you counsel patients on?
I'll focus a little bit on Parkinson's disease since that's my wheelhouse. One of the biggest things that can improve not only motor symptoms in Parkinson's disease, it also may have a role in slowing progression, is quite simply exercise. And what I've learned about counseling patients about exercise is that you cannot quite simply tell somebody to exercise. This never works. People chuckle, they say sure when I find the time. And what I do for patients, especially those that are a bit reluctant to exercise, I get a concrete commitment from them. I tell them the studies show that 30 minutes a day, 4 days a week of some type of exercise that's vigorous enough to make you huff and puff has been shown to help in Parkinson's disease. I know that that might be quite a reach for you, but let's talk about what you can do. And what I ask them is I ask them to make a commitment. I say, what kind of activity do you think you could do? And they perhaps might say, I could walk. So then I say, how many days a week do you think you could walk? 3, perhaps. And they say, well, how long would you walk each time? And they perhaps say 10 minutes. Then I say, well, what time of day are you going to walk and what days of the week? And they start to look at me funny at that point. But then I can engage them. Okay, you say you're going to walk Monday, Wednesday, and Friday at 9 a.m. for 10 minutes. When I see you back, I'm going to ask you about it.
Mm-hmm.
And so they have made a verbal commitment. It is concrete. It is measurable. We talk a lot about the SMART goals. And so, of course, they are specific, measurable, achievable, relevant, and time bound. And that is what I'm trying to accomplish with my patients when I talk about exercise. And you have to meet people where they are. If they can't do that 30 minutes, 4 days a week, I say, let's find something that you enjoy, or maybe we can pair that with something that you enjoy. You like audiobooks. Why don't we make you an exercise audiobook? You can only find out what happens next if you exercise along with it. Or an exercise buddy, or class, or community. Wherever people are, I try to engage them in a way that enables this to be something that they can truly achieve.
I really like the question of what time are you going to do it? So they're really visualizing what part of my day is this going to fit in.
So I find that whenever I ask people what time of day and what days, they have to envision themselves doing it. And once they envision themselves doing this, they imagine how they can incorporate it in their lives. It makes it much more possible and much more feasible for them to do, and it becomes less abstract and much more concrete.
Do you ever explain how good or bad habits physiologically impact the neurological system?
So absolutely. One of my favorite phrases I tell patients is, if you sit too much, you get very good at sitting. And this is true. Encourage people to think about what is important to them. For many people, independence is very important, especially as people age. People value independence, being able to do the things that they want to do by themselves. And so I appeal to that. I talk to them. I say, you want to be able to do things yourself, and you want to be able to continue to pick out your own clothes. You want to be able to choose where you're going to go to get the groceries today. If you want to maintain your independence, these are things that you can do. And so I appeal to their own personal values in that way. It helps them prioritize things that are truly important to them. Other things that I do are that I appeal to how movement can impact the way that your brain works. So for instance, in Parkinson's disease, we have a relative lack of dopamine. And dopamine has a role in letting us move as fast as we want, as big as we want. And in Parkinson's, effectively, that knob of how fast and how big we move gets turned down. And so to counterbalance that, to counteract that, I encourage patients to retrain their brains by moving more. So it's not necessarily just about cardiovascular health, but it's about retraining your brain to tell your brain, hey, you need these systems to be able to move. Let's strengthen them. Let's find accessory pathways to get your body to move more. And patients, when I get them to really engage in this, they really do feel better. And this reinforces them when they come back. I really felt better after this. And then I can reinforce that as well. You look better, you're functioning better. And in that way, we keep this positive empowerment going for the patient.
That is so powerful for the patient to understand why they should implement those changes and explaining it in a way that they can understand.
And in medicine, we tend to appeal to fear sometimes. This will happen if you don't. Much of the psychology literature actually shows that is not as effective as more positive reinforcement. And so I try to be encouraging. I try to appeal to values. I try to show them the benefits rather than saying, you're going to lose the ability to walk. These more negative punishments are almost theoretical in nature. They say, oh, that could happen, but what if it doesn't, right? And then you never get that reinforcement. And so I find that it's less empowering to the patient.
Are there any specific health markers or indicators or metrics that you use to evaluate neurologic health?
Certainly. So in my old-fashioned sort of way, we certainly still use markers. And so when the brain starts to not function, you see the outcomes in the body. And so you can see, for instance, cognitive markers. I ask people a lot of history questions. How's your thinking and memory? What sorts of things do you forget? Are you driving? Do you manage your own medications and bills? All of those sorts of things are markers of cognitive function, which is a marker of how healthy the brain is. Next, I ask about, are there things that you might ask for help with? Are there little things that you have trouble doing, buttoning buttons or tying your shoes, getting up from a low chair? Are you able to get off of the floor? So Atul Gawande actually in one of his books mentions how everybody should practice getting up off of the floor, as it can be a life-saving technique. For anybody who has worked in inpatient medicine, we know that we've met the patients in which they were found down, could not get up for a significant period of time. And they come in, for instance, with kidney failure from rhabdomyolysis and so on. And so again, just that life-saving technique of practicing getting up off the floor is a functional marker for me. So I look at how people function in the world as my marker for brain health and for physical health as well. So maybe I don't follow so many lab values or things like that, but I look at what's their weight. Is their weight stable? How's their mood? How are they physically functioning? And certainly, as a movement disorder specialist, we have rating scales for motor symptoms in Parkinson's, and we assess them most visits, actually. So we look at how they tap their fingers or move their arms or tap their feet or how they walk and how much tremor they have. Those are markers for us for progression of disease. Now, that can certainly fluctuate over the course of the day, depending on what medications they've had, but it can be a numerical marking for us. But for us in neurology, we don't often follow lab values, but we really focus on day-to-day function.
What is the extent that modifiable risk factors play a role in some of the conditions you treat in your specialty? So is there a potential for me to intervene early through patient education?
I think that one of the most important things in what I do, which is a little bit of movement disorders, but I also do a fair bit of cognitive and geriatric care, is the role of exercise, but also other things that can have risk for the brain. So one of the big things that is unhealthy for the brain is poor sleep, which affects a great number of the population. And poor sleep, chronic insomnia, those sorts of issues can actually be a risk factor to dementia in the long term. So I often ask about sleep. I counsel about sleep. I am a big fan of sleep hygiene. One of the analogies I love to use, especially in the geriatric population, I ask them if they had children. And many of them have. And if not, I say, have you ever babysat a baby? And usually the answer is yes. And so I ask them, what do we do for babies to get them to sleep? And what do we typically do is we are very strict about bedtimes. We put them to bed at the same time. We wake them up at the same time. We have very strict schedules. We put them to bed in a dark, cool room. If they are fussy, we get them out of the bed, we calm them down, and we put them back down. We don't set them in front of screens. We don't try to play with them in the middle of the night the best that we can. We try to keep things calm to try to get them to go back to sleep. We try to make sure they get plenty of activity during the day so they try to sleep at night. So I make that analogy because I think that we're much better at sleep hygiene with small children than we are with ourselves. And so I often appeal to that in regards to good sleep habits. And I think there's a great power in simple things like natural sunlight first thing in the morning to help set our circadian rhythms. I think that has a great role in sleep as well. And so I'm a big evangelist for sleep and good, healthy sleep habits. And I think that's one place we can intervene early. Another thing that we don't often think about also is attending to hearing. Decreased hearing in midlife is actually another risk factor for dementia. Even if people are able to hear in everyday conversations, if they're not hearing things in the background, other small conversations, those are all actually ways that the brain is stimulated. And so if they're missing out on those sorts of things, this can be a risk factor for later development of dementia. So for any preventative medicine doctor, certainly checking in and saying, hey, when was the last time your hearing was checked? I think that's an important piece of prevention in terms of maintaining brain health.
So now the big question of this podcast is, what could robust health in your field look like for a healthy patient? What does it look like beyond just the absence of disease? What would exceptional neurological health look like?
I talk to my patients about this. I talk about what is your brain designed to do? So as a medical student, you study the brain and the functions of the brain. And if you were to summarize, the vast majority of your brain is devoted to basically 3 activities, one of which is movement of your body. We think about our primary motor cortex, supplementary motor areas, the cerebellum, the basal ganglia, which serve to coordinate movement. So that's one thing. It serves to move your body. Number 2, it serves to interpret outside stimuli, things we see, hear, feel, touch, all those sorts of things our brain processes and understands. So coming from the multiple senses. And the last thing is that the brain is used to communicate with other human beings. Our unique faculty of language. We interpret faces. We have emotions that we communicate to other people. We read other people's emotions and respond to them. So when we think about the functions of the brain to move the body, interpret outside stimuli, and communicate with other human beings, the best way to have robust health neurologically is to engage in those things. We move our bodies, we get out the house, and we see other people. And those are the best ways to maintain robust neurological health, are the people who engage in regular physical exercise, people who are socially engaged, who do things that have some amount of intellectual stimulation or intellectual challenge, people who engage in new experiences. They try new things, whether that's new foods or a new book or whatever it is. they engage in things that are stimulating for the brain to allow them to maintain their neurological health.
We go into this career to help people, and it's also as important for physicians themselves to take care of their own wellness. Is there anything you do in particular to maintain your own well-being in a field that can be stressful?
What I try to do, try is the key point, is to hold myself to the same exercise standards as I hold my patients. Even if it's a 20-minute class on my phone, sometimes that's all that I can do. Sometimes it's just walking my children to their school and making that probably as fast as I could walk, which is perhaps not that fast. But I love taking my children out on new experiences. We try to have a great variety in our diet, lots of vegetables, fruits, things like that. And I find that I have engaged in more healthy behaviors in trying to teach my children healthy behaviors as well. So we go outside, we do physical activities, we spend a lot of time with family and doing social events and talking to other people and talking about all the different types of people that are out there and trying to understand them. We talk about how to manage our emotions. And so we do a lot of emotion regulation at home, talking about what are things that bring us calm? What are healthy ways of managing these sorts of things? So I find that the things that I try to do to make sure that I maintain my own wellness have actually improved as I try to teach that and instill that in my own family.
Do you have any advice for medical students? This could be anything from finding a specialty they're passionate about or how to stay well themselves.
I have so much advice. My favorite advice is to give yourself a little grace. This pathway is hard. There are high expectations, and I promise you, your own expectations for your own performance are much higher than anyone else's. So I think giving yourself a little grace, a little flexibility, a little time to breathe. There are going to be times in which this job is just a job. And perhaps your specialty may not be your passion, but it should enable things that you are passionate about. So for me, my passion is really and truly education. While I love neurology, education has really always been my number one. And so maybe you're okay with the kidneys and you don't like them and they're not your favorite, but you still want to do internal medicine because you want to be that comprehensive type of physician. That's great. Perhaps really your passion is working with health equity in underserved communities. Then you find yourself, whatever specialty will help you to do that in the best way possible. As you search for specialties and search your pathway and search your career options, I think you should really come down to what are you truly passionate about? And it doesn't have to be a specialty, but whatever you choose to do can enable your specialty the best that you can. So when you're thinking about choosing residency programs, do not think about what is the best program on paper. Do not think about what is the highest rated, which one has the highest step scores, but think about which program can make me the best physician that I want to be. And maybe that's the program that is close to home, because having that support network will enable you to succeed in your residency. Maybe it's having a program that has a mentor that will really engage you towards your own career goals. So as you're picking residencies, the tendency is to go for the big name ivory tower, but think about what is going to help you in your career specifically, instead of what everybody else perhaps may be pushing.
The last question I have is, if you had to choose a walk-up song, what would yours be and why?
Oh my goodness. I'm trying to think of that's really hard. Oh my gosh. I have never had to think about that one. I also don't want to be like an old fart, but
No judgment at all.
tell you what, let's go for something empowering. There's a fun song by Max Frost called Good Morning, and it's just very fun, it's empowering, it's energetic. It's just a fun listen. And so if you want to go for that one, since I talk about, mornings and morning sunlight and things like that, I think that would be a fun one.
Thank you so much,
Of
Dr. Vu. I
course.
really appreciate you coming on here. This was wonderful. This was exactly what I was looking for.